Hi, I'm Kelly Bauman with the Salvation Army Samaritan Center. We offer adult day services to people from the community. We help families take care of their loved ones and give a sense of purpose to the participants. I invite you to stop in or call to see what our program has to offer. We are located on West Hubert Avenue in Lancaster, and our phone number is 740-687-1921. Remember, the Samaritan Center changes how you live, not where you live.
Welcome to this edition of Lancaster Perspective. I'm Mike Miller. Thanks for tuning in today. My special guest from the Fairfield Community Health Center, the CEO, Lisa Evangelista.
Hi.
How you doing?
Good. Great.
Thanks for being here today.
Oh, thank you for having me.
Now, we are taping this during Festival Week, so have you enjoyed all the food at the Festival Week?
Absolutely, absolutely. And we actually, our administration office actually participated in the Friday night art walk.
Fantastic.
Yes, it was a great time. Great time.
It's I enjoy it. I mean, I like to partake as much food as I can, but it's great. Now, do you go to the shows? Do you
Actually, yeah, almost every single one of them. We just went to the AC/DC one on Wednesday night, the tribute band.
Sure.
It was fantastic, and then we'll be closing it out with Vince Gill.
Did you see the Jersey Boys?
Yes, they were fantastic
Good,
as
was
well.
it?
Yeah.
It was so hot.
It was really hot.
Yeah, I heard they were excellent though.
They were. I mean, this has been, I think, one of the best art fests that I've been to, and I've been to a lot of them.
Really? So. Oh, that's fantastic.
Yeah.
Ken Culver's done a great job with that.
Oh, he has.
He has done an absolutely fantastic job with that. Let's talk a little bit about the Fairfield Community Health Center. Talk a little bit about your role in the center itself.
Sure. Well, first of all, let me tell you a little bit about Fairfield Community Health Center. We are a federally qualified health center, which means that we do get some funding from the government. And what that does is that gives us the ability to serve the people that don't have insurance. So actually what Fairfield Community Health Center does is we serve the medical needs of the community for anyone who needs them. No matter if you have insurance, we take insurance, we take Medicaid, we take Medicare, we take nothing. We put you on a sliding fee if you don't have insurance, and we'll take care of your medical needs.
And you're not affiliated with Fairfield Medical Center, with the health department?
No, we're not.
Okay.
What we were way back about 5 or 6 years ago, we split away from the health department as a lookalike. And then once the federal government grants you the federally qualified health center status, you are available for funding. And so that helps us take care of the people that don't have the funds to get health care.
Now, is there an age limit? Is there?
No age limit.
None at all?
No, we take care of people from age 0 to however old you want to become.
Wow. And where's the office? Let's talk about, the offices. I know you have
The
several.
offices, well, our administrative offices is actually downtown, which is good because we get to participate in a lot of the downtown events. And that is across from the post office, 207 South Broad Street. That's our administrative office. We have one of our health centers is at Main Street. It's in the Kroger parking lot. And that is our biggest location, and that also houses a residency program. So we partner with FMC for their medical family practice residents, and they actually do rotations at that location. We also have a Hunter Trace location, which is out on 22, right before you get to the Amanda, where it says Amanda 7 miles. And then we have a Baltimore location. So we're kind of spread out, but we want to serve the people in Fairfield County as much as we can. So.
Website, phone numbers, the easiest way to get a hold of you?
We have website. Our website is, I believe, www.fairfieldchc.org. We also have Facebook page, so just Fairfield Community Health Center Facebook. You'll go right on the Facebook page. It tells you all the activities that we do. We have a very unique bunch of individuals that take care of our patients. We have great providers. Our CMO is Dr. Robert Dominguez, so he heads up all of our providers. We actually have started offering behavioral health services at the beginning of this year. Wow. And we that has just been going wonderfully. That is a service that is really needed in this community.
Now, does someone have to be referred to come to you, or can they just walk in the door?
What we do with the behavioral health is they actually have to be a medical health patient for us. And then what happens is if we decide they need to see a behavioral health specialist or a counselor, then we make a appointment for them at that point.
Is it 24 hours or?
It's not 24 hours. You have doctor availability 24 hours through a phone messaging system. So what happens is we actually have extended hours at the Main Street location. So we're open till 8 o'clock Monday through Thursday, and from Saturday 9 to 1. And what happens is if somebody calls and they need service, they'll get put through whatever doctor's on call. So we basically do have 24-hour coverage. It's just our offices aren't open 24 hours.
And as I'm going through this brochure, which is really a nice brochure, it says that you can connect with assistance, transportation, parenting skills, housing, utility assistance, food, education, smoking cessation, and language interpretation.
Correct.
That is amazing.
Right. We collaborate. We have been collaborating, especially the last couple of years, with everybody in the community. One of our most successful, there's many successful programs, but one of the really great ones that I think is wonderful is our prescription produce program. What happens is, and this is at all of our locations, a patient comes in and we screen them for food insecurities. And if they do have a food insecurity, then the doctor writes a prescription for produce. And our food pantries, we've partnered up with Lutheran Social Services and a few other food pantries in town, and we'll send that prescription through Fairfield 211. And what they do is they handle that. They see if the person needs any other services, and they send it to the food pantry, and the patient can go pick up their produce every week.
When you say, I don't have a medical background, when you say screen for deficiencies, what do you mean?
Food insecurities. A lot of people don't like to say they don't have enough food to eat.
Okay.
So what happens is if you put it into a medical background and they think they're going to go see their doctor, they'll be a little bit more honest about that. And what happens is if the doctor says you really need to start eating vegetables 5 days a week,
I gotcha.
and then what happens is they write out a prescription for the produce, and so that 9 times out of 10 the patient goes, wow, this is great, I'm going to go and get it. So, and then also we try to hook them up with other services they may need through Fairfield 211.
So this is a community effort.
It's absolutely a community effort. That's how we stay successful with getting the patients in that need to be seen. We are here to take care of our community. And so, we're all successful because we collaborate very well with each other. I think this Produce RX program has been very successful in our county because we work so well together. I mean, you had to hook up 3 different organizations to make this work, and we made it work. And we've been doing it for over a year, and we've probably served over 1,000 patients.
Wow.
So that's fantastic. That's just one of the many successes that we've had.
Now, I know there's an event coming up in the next week, Health Center Week?
Yes, and actually we call it Health Center Month.
Okay.
We've kind of expanded it this year, and it's to celebrate our patients and our employees, but actually the whole community can be part of it, because what we're doing is we're starting the first week of August, August 3rd at the Baltimore location. We will have a food truck available from 11 to 2. For people to buy a very inexpensive lunch, and then it's going to be free for our patients and our employees.
I'm assuming you won't have Mountain Dew. Just saying.
So,
okay.
And then we have like gifts for the employees, and we have free gifts for our patients as well, like hygiene kits, and we have a little school pack for the children. So it's really exciting, and we have that throughout the month. So the Baltimore location will be the first location, then it'll be at Main Street and Hunter Trace the second week. The food truck will be there as well.
Okay.
And then throughout the rest of the month, we're just going to be there, giving away giveaways. Free stuff. Everybody loves free stuff.
That's amazing. Now, obviously it takes some money to do this, and you talked earlier about getting some assistance.
Well, what's really been good is we have we serve the Medicaid population as well, and we have some managed care companies that have really contributed to this cause. And so they will be available when we have our table out with the free gifts, because they've sponsored us.
Sure.
And what I had told the people at the administration office, we have outreach and enrollment specialists that actually, when we sign up for the healthcare exchange 3 months out of the year. They handle that. And then the rest of the year, they do all kinds of things. And this is one of the things they've been helping with. And they have been wonderful with reaching out to Molina, CareSource, Buckeye, and they've all contributed money. And then that I matched with our funds, so we would have some money to be able to provide, you know, the giveaways for the patients and the employees.
How many people usually attend this during this week or
You know,
during the month?
it varies. It's been growing every year.
Sure.
So we're hoping we're hoping we touch over hundreds of patients and people in the community. And this gets the word out that we're here to take care of you.
Absolutely.
You know, when you can't go into a doctor's office because they've already got their quota of Medicaid, we'll take care of you.
Oh, I got you.
Yeah.
Okay.
So I mean, there's a lot of people that do handle our patients, Medicaid patients, but it's harder for them.
Sure.
And then also people that don't have insurance, that's really hard. So, you know, we're trying to close the gap in the community for people that don't know where to go when they don't have the money or.
If they don't have the money, what do they need to bring to you?
They need to bring proof of their income. So if their income is so low, then we put them on a sliding fee scale. So as low as $25 for the visit, and that would include everything that's done at that visit. We also hook them up with our outreach and enrollment specialists because maybe they don't realize that they can get Medicaid, that they're eligible for Medicaid. So there's a lot of things that we can help these patients with, and we try to provide a holistic approach to their health care.
Now, will you have an open house at the main location or during this month, or will this just be in the
Usually
town?
this is center-based.
Okay.
So, but all of our people at the admin will be at each different location. So we like to make sure we're spread out, so people have questions,
Sure.
we can answer them. We give away the hygiene kits, we give away the school kits. We have some special events for the employees. So it's basically a whole month
Right.
approach, and we're hoping to get some congressmen and senators here to visit our centers
fantastic.
too. We've got the letters out there requesting,
Sure,
you know,
yeah.
and a few more.
They're pretty good about that.
Yeah,
I
so I
mean,
think
they're
we'll
all-
get some local people hopefully, and since we have it the whole month, it's just not for 1 week because Health Center Week is actually from August 7th through the 13th.
Okay.
And so hopefully, since we're extending it all month, they'll be able to come in and see what we do for the community.
Now, when people come to any of these locations in Lancaster or Hunter Trace, Baltimore, do they need to make an appointment or should they just walk in?
Well, actually, we have, most of the time it's appointments,
Mm-hmm.
but we do at the Main Street location because the hours are extended till 8, we do have a lot of walk-ins.
Sure.
And a lot of times we have open access so we can get them right away, but if they absolutely need an appointment, it's always best to call because we do keep same-day appointments
Mm-hmm.
available for everyone.
That's it. Just in your own mind. And you've been there how long now?
I have been in there 4 years.
Okay, but you started out as
I
financial
started out as
officer.
the CFO, and we went through a little bit of turnover with a couple CEOs, and I think a lot of it is you really do have to have the mission heart to want to help these people. And this is my community, and so when I moved back 5 years ago, this was a perfect fit for me
Sure.
because it was like, I want to be here, I want to be part of this community,
Right.
and I want to help those who need help. So it was a really good fit, and so it was very frustrating when we'd hire people and they didn't seem to get it.
Right.
So I finally said, okay, I will do this.
I'll do this.
And I've been in this role for a couple years, and it's just been fantastic. You know,
Right.
we just recently bought a school building, South
Right, South
School,
School.
which is very, very exciting for
Right.
us. So that just happened. We want to renovate that. We want to expand our services.
Okay.
You know, hopefully to include dental in the future, which is a very great need in this community. Expand our behavioral health. Of course, expand our medical services. And I think, you know, that has been a very beneficial thing for us.
Now, when will that building be ready? When will
I'm not real sure. We're still in the closing process, so I'm thinking between 2 and 3 years we'll have it
Okay.
completely renovated. Now, we may do that in stages.
Sure,
So maybe the first, it's 2 floors. First floor will be the clinic and everything else, you know, medical. And then the second floor will be administration offices, so.
Now, is the community health center unique to communities, or is there one in Franklin County? or-
We have actually 45 community health centers in Ohio.
Wow.
Not every county has them. So like for instance, Columbus has, you know, maybe 4 or 5. So the bigger cities, you'll see more
Right.
health centers. We're the only one in Fairfield County. There's a lot in Piketon County and south.
Sure.
And they're kind of all over
Right.
over Ohio. There's probably 4 or 5, 6 counties that don't have a federally qualified health center.
Have you ever gone to one and said, "Oh, I'd like to do that. Boy, I like that program. I'd
Well,
like to do that."
what's funny is we have an Ohio Association and of community health centers, and what this association does, it ties us all together. We're all board of directors. All the CEOs are board of directors. So my success has been people mentoring me, because this was new for me. I come from a nursing home background, so the clinical piece wasn't that tough for me
Sure.
to grasp, but just how it runs, but you have government funding, it's different. So there was a couple of health centers that really, really helped me out, their CEOs. They came down, did mock audits, said, hey, you really need to do this, this, and this. We have actually gone up to one in Findlay area where they have a behavioral health. And so that behavioral health, we want to do this right.
Right.
So, he gave us all kinds of helpful guidance, and, it's still a little bit different than what they have, but it helped us. And I think that's why, 7 months later, we're very successful with getting people in and treating them for the mental health issues.
Oh, I was looking at some of the stats. It said that visits have over 18,000 visits. 18,000? That's amazing.
Yeah, and it's probably going to be closer to 22 to 23 this year.
Wow, and about 70% are from the Lancaster area. There's a couple other things there, but and it looks like there's new patients that are coming in also. It's not just return patients.
And what's helping with that is when they realize in order to get the behavioral health services, we want to treat them for everything.
Sure.
So they come in, they get medically treated, and then they get referred to our behavioral health service. So that has helped our new patients increase.
Did you think you'd be doing this 15 years ago?
I never imagined in a million years I would be a CEO of a small organization. But I love it. I mean, it's just interesting how your life kind of propels you towards the ultimate career. And to me, this is my ultimate career. I love seeing it, expand. I love how our employees are so passionate with our patients. And it goes throughout the organization. And I mean, we have 47 employees, but every single one of them want to do what's right for our patient. And, that's just wonderful.
When you start thinking outside the box and thinking, okay, we have unlimited funds, what would Lisa like to do? I mean, we talked about
Unlimited
school,
funds would be wonderful, but, and we're taking it in small steps. This opportunity came because we could afford it.
Sure.
And I think my next is I would like to provide more service sites, and probably outside of Fairfield County. I mean, that's probably 5 to 10 years from now.
Sure.
But I think there's some counties that are underserved, and I think a community health center would definitely help that population. Growing our services, dental, vision, having a community garden, which that may come sooner than later since we have some land now. So it's really exciting to what we can do and achieve for the for the people in this community.
Oh, sure. Do you ever get people that say, "Why don't you do this?" I mean,
Yeah. Why don't you provide dental?
as you've mentioned it a couple of times.
Yes, I mean, and I do know that's a really big need, and that is something that we're really focusing on. We are probably going to grow our outreach and enrollment area because I'm telling you, people come in all the time wanting to, I don't understand this healthcare exchange, I don't know if I'm eligible for Medicaid, or I got this letter, I don't know what this means. We have 2 wonderful people that do that, 3-4 months out of the year, but it's usually all year because
Right.
people are coming in all the
And
time.
I can see that being, working in government for 20 years, that, I mean, obviously the things you have to read and absorb, but that would be I would think something people would want to, I just don't understand this. I don't know what this means.
Right, and so we have people to help with that, and there's just a lot of information out there that changes every year. The field's changing all the time, which is why it's so interesting.
Sure.
Yeah, you just have to be real flexible.
Absolutely.
And change it,
That's
yeah.
I know we talked about expansion and South School, but expand the staff? Would there be a time?
Oh, absolutely.
Yeah, we need more doctors.
Expanding,
we need this,
well, and what's great is, since we have a residency program through FMC, what happens is when they graduate, if we have the space, we can hire them. You know, we can offer a lot of things to new docs. Because we're federally funded, we can offer them student loan repay back. So, you know, they get a certain amount every year, tax-free, that they can put towards their loans. We also have a tort that covers them with malpractice. FTCA, our federal tort. So, I mean, we have a lot of things that is beneficial for new docs when they come in.
Sure.
We have just pretty much maxed out our capacity right now. So, absolutely.
That's a good problem to have, though, right?
Yeah, right. And so now we can kind of tighten up our process, you know, make sure we're giving the best care to the patients, and then as we renovate and add, you know, new clinic exam rooms and new services, absolutely. You know, I bet you in 5 to 10 years, we'll double in size.
No kidding. Wow, that's fantastic. And we talked a little bit about government funding. There's always strings attached to government funding.
Yeah, there always is, and you know, part of it is we're probably 30% funded from the government. The rest we have to collect like everybody else does. But you know, it's okay. You know, I think if you abide by what they want, you can manage it pretty well. And I have been through it, and it probably was good for me to be the CFO first, because
absolutely.
I kind of managed through that. So becoming the CEO, it was easier for me to say, okay, we can go after this, or we can go after that. And so, you know, that's helpful. Now, you know, there's other grant funding opportunities that we'll probably go for, you know, to get some renovation money. I'm not ruling out a capital campaign, you know, so I think all of those things, when people see what we're doing in the community, I think that will help us achieve what we need to achieve.
I think you like your job too much. I think you're too much into doing all these things, and I know we've talked about this a couple times with the health, or the health center month coming up. Do you collaborate with other counties to do like a health center month with them, or?
We haven't gone that far yet.
Okay.
I think we kind of do it within the area, just so we make sure we touch everybody there. But that's not saying it won't happen. I mean, we went from a week last year to a whole month this year. And we do collaborate a lot with other counties when it comes to outreach and enrollment. And like I said, you know, I've reached out to other community health centers when it's like, okay, I don't have a policy for this. Do you have a policy for that? So.
That's it. Now, can somebody from another county come to Fairfield County?
Oh, sure.
Do they have to? Okay.
Yeah, we have people from all over the state that can come if they want. It's mostly surrounding counties. I mean, we have some people from Columbus, but there is a lot of qualified health centers in Columbus, community health centers. We have people from Logan. We have people from, you know, surrounding counties that come to us.
Right.
So we're not limited just to Fairfield County.
That's amazing. That's just
Yeah,
there's just a lot of stuff going on, and I know that the health center month coming up. I want to talk a bit more about South School. You talked about dental and vision. Are those going to be separate departments? So it'll be like medical and then dental and.
They'll be within the organization, but and it'll be kind of like what we've done with the behavioral health. You have the clinic site, and then behavioral health is there, and then you'll have the dental, and then you have vision. So, and we have, I think it's 30,000 square feet. So I think we have enough room to really renovate and advance that.
And
objective.
One more time, website, phone number that people.
Phone number is 740-277-6043, and that will take you right into our phone tree, and that you can make an appointment at any one of the locations. You can also stop by and make an appointment. You can come to the admin office, which is on Broad Street, to make an appointment. If you need healthcare assistance, if you need to get some insurance, absolutely stop at our administration office. We always have somebody there to help them.
One of the things that we talked about earlier was transportation. Talk a little bit about that.
Transportation, if you have a problem, like you go to a doctor and the doctor is referring you to somebody that you really need to see, and you have a problem getting there, we have a contract with a transportation company that we will provide you with, and we will also tie you into public transportation, Lancaster public transportation if you need it. And most of the managed cares In Ohio, if you give them like 48 hours notice, they'll provide that transportation for them as well. So we hook them up with
Sure.
whatever fits. If they're uninsured, we'll go ahead and hook them up with our contract. If they have the managed care programs, they'll hook them up with a transportation. So we always want to make sure that they can get to where they need to go.
One of the things that I was looking through your brochure, talking about physical exams, that people can come in and get employment, sports, whatever it might be, which is a bit, especially this time of year, kids are back in school.
Immunizations. We have a big push for childhood immunizations. We send postcards periodically. One of our big initiatives is the colorectal 2018. We actually were the 1,000th signer of the pledge, and we were recognized at the relay a couple Saturdays ago.
Really?
In July 9th, for the American Cancer Society. So, yes, we're very big players in that with, getting people to get screened after 50. So, any type of screening, any type of immunization, we want you to make an appointment and we'll fit you in.
Time has flown by, Lisa. We just have a few minutes left. Anything else you want to talk about that we haven't covered?
I think we've covered a lot, and I just want to make sure that the community realizes that we're here, and we're here to help them and their medical needs.
Before I came on, people had called and said, okay, what's your show going to be about? And I was telling them, and this has been very interesting. I didn't realize everything that Fairfield Community Health Center did. I did not. But again, it's been great having you here. We appreciate everything. Good luck. And you need to, kind of calm down. You actually need to bring it up. You're too quiet. You need to,
quiet?
Yeah, you're way too quiet. But
Well, thank you so much. I appreciate sharing the information.
and we'll have you back on.
Oh, great.
During the month, we'll have you back on to talk about it. So it's been great having you here.
Okay, thank you.
Thanks for tuning in to this edition of Lancaster Perspective. I'm Mike Miller. And remember, until we meet again, let's make a difference.
In 1929 in Chicago, a gentleman by the name of Marion Wade, former minor league baseball player, started the company. It was just a moth-proofing company then. In 1952, it expanded to carpet cleaning and pioneered what is now called outsourcing. And the Sidwells wanted a community that had a lot of churches, had a lot of soccer opportunities where kids love soccer, and a good Parks and Rec department, so they chose Lancaster. And so in 1980, they moved the franchise here in Lancaster to 6th Avenue. But then in 2002, Todd George, current owner, purchased the franchise from them. And in 2004, he bought a building that's on Mulberry Street, and that's where the franchise is located currently. I'm Jay Johnson, General Manager of Service Master Clean by Todd George, where we guarantee if it's not done right the first time, we'll do it again.
Service Master Clean by Todd George, 740-687-1077, 740-687-1077.